my name is McKenna Knipp. It's January 25th. I'm an 8th semester nursing student, and today I'm going to be explaining a chest tube to the patient. My patient experienced trauma to the chest due to a car accident, and there is blood in the pleural space. Hello, Mr. Smith. My name is McKenna. I'm going to be your student nurse today. Can you go ahead and tell me your name and date of birth? Okay. Because of the trauma that you experienced from your car accident, there is bleeding in your pleural space, so the doctor has ordered for a chest tube to be placed. So I'm just going to explain it a little bit to you. This chest tube is going to drain the blood from your pleural space, and it will help your lungs re-expand. You will be awake during this procedure, but medicine will be given to you to make sure you're as comfortable as possible. We will make sure that you're comfortable and checking your vital signs frequently, as well as your breathing. Within this chest tube, it is a plastic tube that is inserted. It will be sutured in, and an airtight dressing will be placed over the sutures. There is 3 chambers within this chest tube. There is the collection chamber, which when the blood drains from your pleural space, it'll go into this chamber. Each shift, the nurse will mark the date and time of where the blood has drained to. If this chamber does fill up before it can be removed, the chest tube can stay placed, but one of these will have to be replaced. The next section is the water still chamber. 2 centimeters of sterile water will be placed, and basically every time you inhale and exhale, it will be tidling, so it'll be like a wave going back and forth. If there's a little bit of bubbles in here, that is okay, because most likely you're just coughing or sneezing. But if we see excessive bubbling, that means there's most likely an air leakage coming from your tube. The next section is the suction chamber. In this chamber, it can be wet or dry. If suction is needed, a thoracic suction will be ordered from Central Supply. If after this is placed, if you need to get up to use the restroom or rotate, or if you're experiencing any shortness of breath or pain, please call out so that we can prevent any damaging from this being pulled out. I would like for you to cough and deep breathe as much as you can tolerate. I will be listening to your lungs more frequently to making sure that the lungs sound okay. Sometimes there can be air that gets under the skin, and that'll sound like Rice Krispies, or it'll feel like tissue paper kind of. That's called subacute emphysema, so make sure if you're experiencing that to call out for help. We will do an x-ray in 2 to 3 days to see how the drainage is from your pleural space. If the doctor says it's okay, he will remove it at bedside. And also, once this is removed, it will be placed in a red bin and taken to dirty supply. Do you have any questions for me? After the procedure, I will document how the patient tolerated the procedure and if there was any complications.